This is a voiceover for Pam's cataract surgery. The first step here is putting in some anesthetic solution to help numb the eye, inside the eye and then on the surface of the eye. We next put in a protective jelly. This is a very high-end substance that's used to protect the inside of the eye. And you can see the jelly filling up the front part of the eye, just about there. Now all the instruments you're going to see in this are actually made by Bausch & Lomb, and they're the Devgan design. They're my own design. This is a ring that I use to just stabilize the eye. We call it a fixation ring. And the tiny incision for the surgery is actually made with a diamond. This is a gem quality diamond, costs many $1,000s. You can actually see right through it. And there are a couple of bright reflections from it. This is about 2 millimeters wide, which is very tiny. And I take my time to construct this very important self-sealing incision. Now you see the little tiny droplets of blood? That's intentional. We want that, because that ensures that these incisions will be very well sealed in the future. With these forceps, I now need to create a perfect circular opening. It doesn't have to be perfect, but after doing this so many thousands of times, I can actually create an absolutely perfect circular opening. This should be approximately 5 millimeters in diameter. The tissue that I'm grabbing, where it looks like I'm peeling something off, that tissue is very thin, about 1/20th the thickness of a human hair. In fact, you can see the eyelashes, which are taped out of the way, are much thicker than that tissue. So the cataract, remember, is like an M&M. It's in a shell, or we call it capsule, and we're going to separate the cataract from the capsule using some saline here. This is a blunt cannula, it's not a needle, and we inject this saline solution to separate the cataract. And I do a little bit more of it, and you see some of my jelly that I put in the eyes coming out of the eye. That's all right. And there, that whole thing there looks kind of like an M&M. That's the cataract. That has to be broken up and removed from the eye. So I'm injecting a little more protective jelly in front and behind. And now the device we'll use to remove the cataract is called a phacoemulsification machine. Fancy word for something that uses basically high-frequency ultrasound as well as vacuum to suction out the entire cataract from the eye. We break the cataract up into small pieces. That's just a little movement from the patient. And here comes the instrument. So in my right hand, what's going inside the eye first, this is like a little miniature vacuum cleaner, if you will. And in my left hand is the Devgan chopper multi-tool that I designed. So we'll take this cataract and I'll immediately chop it into 2 halves. The key is this cataract is about 9 or 10 millimeters wide, but I have to remove it from an incision that's 2 millimeters wide. If you look at the reflection on the surface of the eye, you see 3 dots, 3 white dots, a big one and 2 small ones. Those are the lights from my Zeiss microscope. So I don't look at the eye just plain. I actually use a very high-powered microscope to see it in high magnification. We've aspirated out very carefully the majority of the cataract. You can see things starting to look very clear now. And there's a little bit of a wispy cataract material left, which we'll get out here at the end. Now you'll notice that this is looks like a camera red eye. That's intentional. The camera red eye helps me see better inside the eye. So those lights, the 3 white dots on the surface, are such that they increase the amount of camera red eye. Kind of the opposite of what you do in your regular camera if you're taking people's photos. This next device is a little smaller suction device to get out the rest of that wispy stuff. So you can see this little cataract material here. We'll aspirate it down there. I'll use this probe to clean up all the stuff. That blue instrument going in is made of titanium. That's the other end of the Devgan chopper multi-tool. And we use that just to help these little pieces get pushed down the aspiration port. And the wispy remaining stuff has to be removed as well. Now the patient's awake for this, but totally comfortable. They don't know what's going on. They don't see the surgery at all. They don't feel the surgery at all. And this was just because we numbed the eye with those drops at the beginning and the solution that you saw. So now that things are cleaned up, We just take our time to make sure all the tiny wispy little strands are removed as well. That squirt of water coming from the outside is my surgical assistant who helps me just keep the eye wet. The eye likes to be naturally wet, so we use a special sterile saline solution to keep it such. And so now that things are looking really good, you notice there's no cataract material left at all anymore. At this point, we're going to fill the eye up with that special protective jelly again. Total surgical time here is only about 10 minutes or so. Or as Picasso would say, 20 years and 10 minutes. Here comes the jelly that goes inside the eye. This is again to protect the eye and to expand it. It'll be removed at the end. You can see the outline, that round opening that I made at the beginning, and you can see, in fact, it is an absolutely perfect round circle. Now the lights go dark. Why? Well, the flashing green light is a laser mounted to my microscope that's an aberrometer, meaning it measures focusing aberrations or focusing issues. It does more than 1,000 measurements in just a short period of time. And as Pam looks at the light, it helps me determine what would be the best correction for the eye. Ophthalmology is very mathematical. I love math, perfect fit for me. And we're able to calculate how best to deliver the sharpest vision. So our goal for Pam, on our first eye, we gave her 20/20 distance vision. And now on this eye, we're actually improving the intermediate computer range and reading vision, and we'll give her 20/20 on the reading vision. Lights come on now. I have all the measurements I need. I've confirmed it. And this is our new lens. Now, the new man-made lens that goes in the eye is rolled up here, kind of like rolling up a carpet. And then you put it inside the eye, and we open it in the eye. And so here you can see it's opening. The lens is round and has these two arms. And I'll position the lens exactly where I need it to be. So there's the lens opening up. And we center it up. There's a little tiny gas bubble you see there. That's of no consequence. We're going to aspirate that right out. Last time with our special suction device, I'll go behind the lens to remove the jelly that we put back there. Looks like that air bubble came out as well. And we'll go in front of the lens and continue to aspirate out all of that jelly that we had inside the eye. Looks perfect. If you look very carefully, you'll notice this special lens has diffractive rings on it. It has a very faint kind of bullseye target on the lens. That allows this lens to give an extended depth of field. So you camera buffs will understand that. It's increasing the depth of field in order to give a wider range where we just don't need glasses. This is saline being used to seal the incisions. There is no suture here. There's no glue for the tissues. You don't need to. We center the lens up perfectly, just like that. Seal the incisions with just some saline. And that looks great. I'm going to add some medicine to the eye. This is going to look a little bit like a snow globe. These are white particles of medicine. This medicine is an anti-inflammatory that's going to help the eye heal after surgery. This is why the very next day I expect Pam to have 20/20 vision and very comfortable with no pain, and in fact the eye won't even look red. A little bit more saline to seal it up. I'm checking that's the pressure, and I'll use a little sponge here, and that sponge is soaked in anesthetic, and I place it over the incision so that when the surgery is over, the patient's going to be very comfortable. The very last step, which is a little bit off the frame here, is we're going to use another diamond to make a treatment for astigmatism. So there goes the fixation ring to hold the eye. My view through my microscope is much bigger than you see here on the video. And finally, we just check everything with a little tiny sponge to make sure things are good. Here's a little bit more saline just to be sure. Pressure's great. And here comes the sponge. And we check everything, and boy, that looks completely watertight and beautiful. This patient will be absolutely thrilled. And that's the surgery. Thank you for watching.